Well, good evening, everyone. I'm Dennis Stone from the Center for Advocacy and Social Justice at the Jacksonville Urban League. And I'm excited to have a team of our interns talking about COVID vaccine hesitancy and mental health resources for small businesses. I'm going to turn it over to Jamie Krasnogor and Aubrey Gerhardt and others to introduce the topic. And I'm grateful that you're here and grateful for all the work that our interns have been doing to make discussions like this possible and recordings like this possible so that we can share it with the larger community over time. So with that, I will turn it over to our lead intern.
Hi everyone. Oops, sorry.
You got it. Juliet, you got it? Okay.
Yep, I got it. Is my audio okay? First of all, I just want to make sure.
Yes.
Okay, I've had some problems in the past. So, welcome to our town hall on COVID vaccine hesitancy. My name is Juliet. I'm a current intern here at the Jacksonville Urban League, and I'm very excited to be talking to you guys about this. So, let's start off our presentation, calling all the shots. It's on, as I mentioned, COVID vaccine hesitancy and mental health resources for small business. So we're going to be covering a few topics today. Obviously, the top one is vaccine hesitancy, but we're also going to be talking about the vaccine clinical trial overview, reasons to get vaccinated, and future steps if you're not vaccinated. So starting off, I wanted to talk real quick about vaccine hesitancy, which is obviously what this presentation is about. So first, let's cover that. So one thing I really want to make super clear is that vaccine hesitancy is not anti-vax. There's a lot of misinformation going around that's saying that people who are hesitant about the vaccine are inherently anti-vax, and that's just really not the case. There are a ton of reasons why a lot of people could be vaccine hesitant. It includes certain mistrust factors. We're going to talk later about medical mistrust, which is a big problem with the vaccine hesitancy. So I just want to put that out there. Vaccine hesitancy does not equal anti-vax, because I feel like that's a big miscommunication. So let's talk a little bit about what vaccine hesitancy actually is. So vaccine hesitancy is the delay in acceptance or refusal of vaccines despite availability of vaccines. Rather, vaccine hesitancy, yeah, I already said that, sorry. I'm looking at my speaker notes and it's just getting confusing. So the reasons for vaccine hesitancy are complex and context specific and are influenced by factors such as complacency, convenience, and confidence. So what that means is, all right, I cleared it up, we're good. All right, move on, thank you.
So some common vaccine hesitant populations include the elderly or those with pre-existing health conditions, healthcare personnel who are generally accepting of other vaccines, African Americans, parents of children with neurodevelopmental disorders, and recovering cancer patients. I actually researched all of these populations very like in depth, just to see where it came from, and all of these are absolutely valid. Each has their own individual reason, and honestly, the most important part of analyzing a problem is to find out where it stems from, and each of these groups has their own personal reason of why they're hesitant, and just questions that they want answered. So that's kind of what we're here for today. And we just want to say that all these populations and others are completely valid, and just addressing the problem or addressing the issue where it stems from is where we're going to start. And then by the end, we'll have resources to hopefully answer those questions. So reasons for vaccine hesitancy, these are just few of the many. All of them are completely valid. Some fear the contents of the vaccine, the adverse effects, and more, especially if you don't have a science background like myself. You're not really sure what goes into the vaccine or like the different components. So it'd be awesome to like have that, which we will have later in the presentation. False information is so easily spread, especially with today's day and age in social media. It's crazy how fast it can get out of hand. And so we're here today to clear the air and give you some like good, valuable resources to get your information from so that you don't get confused by like any other false information. Medical mistrust, it's prevalent in select communities because of different like histories with bad experiences. That's completely valid. Governmental distrust. Some people view it as it came out really quick, and obviously those who trust the government will be the first ones to get it, and those who are more hesitant for different reasons will not be as eager to get the vaccine right when it was released. Lack of access, misinformation is spread all around the internet, and so those who don't have access to valuable, like reliable resources won't be as eager to get the vaccine. And then pharmaceutical mistrust, the contents of the vaccine and just like the pharmaceutical industry in general. If you don't really know too much about it, it can be difficult to understand, which will make you less eager to get the vaccine.
So, as Aubrey mentioned earlier, there's a lot of distrust factors playing into this, and I just wanted to give a brief history on unethical medical trials, which I believe is one reason that a lot of these communities are so hesitant to get the vaccine. So, just to touch on a few, there are plenty more. The Tuskegee syphilis trial that took place between 1932 and 1972. And just for a little background on this, so subjects were lured into the study by advertisement for special treatment, free meals, transportation, assistance, and they were never actually given any details about what they were actually participating in or the disease they had been diagnosed with, which is in this case syphilis. Nor were they aware that what they were going for wasn't actually a treatment. And so most of them didn't even get treatments, they just got placebos, and a lot of them died because of it. So that's one big one that you may have heard. I also wanted to talk a little bit about the plutonium trials, which I couldn't find too much on, but I think in 1945-ish, doctors began injecting patients with plutonium to better understand the effects of radiation on the human body. Obviously, many of these people are still didn't consent to it in the first place, and it was children. It was just a mess. And then also another one I don't have too much on is the Willowbrook hepatitis experiment, which was a problem due to the fact that they were believed to practice on children in mental health facilities, which they believed was unethical because a lot of these children could not consent to the trial. So moving on, we just wanted to do a quick poll. So on a scale of 1 to 10, 10 being you completely trust and 1 being you do not trust at all, do you trust the vaccine? And if you just scan this QR code on the side, you can partake in this poll. So, as we see from the results, about 44% of participants believe they trust the vaccine. I would say definitely they trust it more than they don't trust it, and 22% also are closer to 10, and 33% completely trust the vaccine, which is very interesting and nice to hear.
So basically, we just wanted to go over some of the clinical trials and just hopefully we can get an understanding of what the vaccine consists of. So if you're one of those people that were on the fence about whether you trust the vaccine or not, we're now going to review the COVID vaccines and what the COVID vaccines had to go through before they were allowed to be administered to the public. So basically, one of the most pressing concerns about the COVID vaccination is its safety. And we want to stress that, yes, it is safe. Clinical trials approval of the vaccine and vaccine monitoring systems were all required before releasing it to the public. So basically, we want to go over the phases of the clinical trials, and clinical development is a 3-phase process. And usually before we even start the phases, we have the preclinical, where basically all the vaccines in the United States must go through 3 phases of the clinical trial to ensure they are safe and effective. In this case, the phases overlap to speed up the process, but all phases were completed. For clinical trials, frequently begin with the preclinical research, which includes the pharmaceutical quality of non-clinical research. As a result, the vaccine is being developed, but has yet to be tested on humans. And then we go into phase 1, which is the human pharmacologic studies in 20 to 100 healthy volunteers, meaning small groups of each people begin to receive the trial vaccine and are studied. And then in phase 2, there are the therapeutic exploratory studies in several hundred volunteers, meaning that the clinical study is expanded and the vaccine is given to people who have characteristics such as age or physical health, which are similar to those whom the new vaccine is intended for. And then last, we have phase 3, which is often the vaccine is being given to thousands of people and tested for efficacy and safety. But other times we do have a phase 4, which are ongoing studies after the vaccine is approved and licensed. That's not a common thing, but we do have that often, different vaccines. Okay, so what I wanted to go over was the FDA Food and Drug Administration approved COVID vaccines. So as we have on the screen, we have Pfizer, we have Moderna, we have the Johnson & Johnson, the 3 main COVID vaccines that we know of now. As for the Pfizer, I found that 90%, the effectiveness of the Pfizer vaccine is reached a peak of 96% at 2 months of release and remained around 90% at 7 months. So it's relatively high. The effectiveness of the 2 doses of the Pfizer vaccine, COVID-19, hospitalization was 93% during the period when Delta was the predominant variant. So it still works even with the new variants that are coming in. As for the doses, we have 2 dose series for the Pfizer. The Pfizer vaccine is FDA approved for use of 2 doses series administered 21 days apart of the adolescents and adults 16 years and older, and is authorized for emergency use in children ages 12 through 15 using the same schedule. Individuals 12 years and older may receive the second dose in the primary series 3 to 8 weeks after the first dose in the primary series. And the vaccine dose is 30 mcg for ages 12 and up, but is 10 grams for children 5 to 11 years. So as you can see, it is working, and we do have to take those 2 doses, and it's FDA approved. It was FDA approved on August 23rd, 2021. And FDA has granted full approval for the Pfizer vaccine for people ages 16 years and older. As for the Moderna, the success rate, the effectiveness, for the Moderna vaccine reached a peak of 97% at 2 months and remained at 94% at 7 months. So as of now, it is higher than the Pfizer, but either way, both are very effective. It consists of 2 doses as well. And the Moderna vaccine is also FDA approved for use of 2 doses administered 28 days apart to adults 18 years of older. Individuals may receive the second dose in the primary series 4 to 8 weeks after the first dose of the primary series. As for the approval, it was approved on January 31st, 2022. And the FDA announced the second approval of the COVID. That's when they announced the second approval. The vaccine has been known as the Moderna COVID-19 vaccine, but now it's been marketed as the Spikevax. If you hear the Spikevax, hear the Moderna, they're both the same thing. But it has been approved for people ages 18 years and older. As for the Johnson & Johnson, the success rate is 80%, so it's a little bit less than the 2, but either way, it's still effective. It's reached a peak of 86% at 2 months and was higher than 80% through the 6 months to follow. As for the doses, you only need 1 dose. It's a 1-dose series. It's FDA authorized for emergency use as a 1-dose series for adults 18 years and older. However, unlike Pfizer and Moderna, it has not yet been approved by the FDA. In terms of the protection against the variant, for Moderna, the study confirmed effectiveness against all variants during the study period. Although they did find a drop in effectiveness over time against Delta infection from 94% effectiveness in the first 2 months after vaccination to 80% effectiveness after 6 months. Although protection against the hospitalization due to the Delta variant remained high at 98% effectiveness. So although we see that there's a drop within the vaccine due to the new variants, there's a drop within the protection of the vaccine due to the new variants. It still is very good at preventing you to get sick and having you to go to the hospital. So it's really, it all works. So while research suggests that COVID-19 vaccines are slightly less effective against the Delta variant, the Pfizer, the Moderna, and the J&J vaccines still appear to provide protection against severe COVID-19. As for the Pfizer, the 3 main components of the Pfizer vaccine consist of the mRNA, which is the active ingredient. It instructs body of immune cells to produce. And then we have the salts and sugar, as well as the lipids, which are the inactive ingredients. So the salt and sugar keeps the body tissues happy and maintains molecule shape when freezing, while the lipids protect mRNA structure. So the Moderna is similar to the Pfizer in the way where it uses mRNA as well, which is the active ingredient. But what makes it different is that the inactive ingredient consists of the stabilizers and then the lipids. So like I said, the mRNA for Moderna instructs the body of immune cells to produce. However, the stabilizers maintains a pH and prevents unnecessary irritation when injected, while like both vaccines, the lipids protects the mRNA structure. So as for the J&J is different from both the Pfizer and the Moderna. For its active ingredient, instead of using mRNA, it uses a disabled version of common cold virus, which provides instruction. It provides instructions to the body. The body uses to build a harmless piece of protein from the virus that causes COVID-19. For the inactive ingredients, it uses stabilizers and salts, just as the Pfizer. However, instead of lipids, it uses a pH balance. So for the stabilizers and salts, it prevents vaccine ingredients from separating, but as for the pH balances, it prevents excessive acidity or alkalinity. Sorry, I hope you guys heard that. So another question that we often have is, can COVID-19 vaccine make me sick with COVID-19? I think that's something that a lot of people are worried about. And the answer that we have for you is no. None of the authorized and recommended COVID-19 vaccines or COVID-19 vaccines currently in development contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID. And then another question that's often asked is, does the COVID-19 vaccine alter DNA? And our answer for you is no. The COVID-19 vaccines do not change or interact with the DNA in any way. There are currently 2 types of COVID-19 vaccines that have been authorized for use in the United States. The messenger RNA, which is mRNA vaccines, and viral vector vaccines. So basically, on a scale from 1 to 10, 10 is very confident, 1 is not confident at all. How confident are you about educating a friend about vaccination? Like previously stated, if you could scan the QR code and it'll take you right to it. So as you can see on the screen, we have a 30% of people feel that they are 7% confident that they can educate their friend. We have a tie with 20% for people feeling 8 and 9% confident of educating their friend, as well as another tie at 30% of people feeling absolutely confident of educating their friend.
So here we have just like a few reasons to get vaccinated. It honestly comes with like a lot of different ones, and just finding one for yourself and making sure that you're confident in one, and just like kind of hearing from everyone of like the different reasons.
This is just the current Floridian vaccination rate because we are focusing on Florida, and the green indicates a higher vaccination rate and the red or more red color indicates a lower vaccination rate. So looking at Jacksonville, it's more in that 60 to 70% range. And this is the vaccination rate for at least 1 dose and fully vaccinated in Florida. And about 91% of the 65 and older population is vaccinated within Florida. So I think that's pretty good. I mean, always room for improvement, but if you are still interested in learning more about what the current Florida vaccination rate, or if you have a loved one in another state, you can always go to the New York Times. They constantly update the vaccinations.
So according to the CDC, unvaccinated people are much more likely to be hospitalized and may even die from COVID-19. This picture actually represents all the deaths from COVID-19 just in the United States, all the way up until September 2021. So as you can see, like this isn't the full view of it, but this is just like the best picture I could find. All those little white flags represent someone who passed away from COVID. And it was actually stated by the Johns Hopkins Medical Center that 2022 is actually, or 2021 was more deadly than 2020, which is crazy in terms of like, you know, we've been going through this for like almost 3 years now. So just being able to like get past it and hopefully develop that herd immunity is, you know, is a goal for us all so that, you know, we don't have to have representations like these. I think that is just crazy. And here's another picture of it. So like I said, no vaccine is going to be 100% effective. And even though we did get up to like the 90s for the vaccines, it's still possible to get COVID with it. All the vaccine is doing is protecting your health, eliminating a hospital trip and maybe even death. So just protecting yourself and having that confidence that even if you do get it, you'll be safe from it, from getting that vaccine and not being a part of all these white flags. I think that picture is just also very, very crazy. So yeah, 2021 surpassed 2020 in terms of COVID-19 cases in the United States, despite the vaccines being readily available in 2021 versus not available or even like fully existed and approved in 2020. So to get to the goal of, having COVID as less of a issue and more of kind of just like an inconvenience that we have to face. No one really thinks that it will like completely go away, but just being able to deal with it on like a responsible basis with these vaccines is kind of like the goal that we're moving towards. And in order to get there, it would really just means getting the most people vaccinated that are able to, that are approved and like ready for it and accepting of it.
So, something I feel like a lot of people are forgetting as we're starting to unmask and a lot of restrictions are being lifted is that COVID is still real. Earlier we talked about variants. So I just want to do a little background on the coronavirus variant. So what is a coronavirus variant? And according to the Center for Disease Control, when a virus has one or more new mutations, it's called a variant of the original virus. So what do you need to know about the variants? Well, since the initial COVID-19 breakout, there have been a number of new COVID-19 variants appearing, including but not limited to Delta, which is the original, Omicron, Beta, and Alpha. The two you may have seen most prevalently in the media are the Delta and Omicron strains, which I'm going to discuss a little bit. So with the Delta strain, it is estimated that Delta caused more than twice as many infections as previous variants, so it's highly infectious. Delta caused more severe disease than other variants in people who weren't vaccinated. And while obviously no vaccine is 100% effective, as Aubrey said, all three vaccines in the US were considered highly effective against severe illness, hospitalizations, and death from the Delta variant. Omicron, which is the most recent one, early studies have shown that Omicron is more transmissible than Delta. Though Omicron has caused record numbers of cases, the variant appears to be less severe than previous variants. And the CDC says getting vaccinated and staying up to date with your vaccine and a booster shot is the best protection against Omicron. And I just have this little video, if it plays, just talking about the new variants heading our way.
Well, we are now more than 2 years into the coronavirus pandemic, and some health experts believe many people are starting to let their guard down. In tonight's Verify, KENS 5 reporter Jeremy Baker finds out why we still need to remain vigilant.
The coronavirus has mutated several times since it first popped up 2 years ago. First the Alpha, then Beta, and the latest to cause a major surge in the U.S., Omicron over the winter, and now BA2. But there is a new one called XE, which leads us to tonight's claim. It is possible that the XE variant found overseas is already here in South Texas. Our sources for this Verify are Dr. Brian Alsip, the Chief Medical Director for University Health, and Dr. Anita Curion, the Assistant Director of San Antonio's Metro Health.
It's certainly possible, but I think some of the early indications are, at least on a practical level, that may not be particularly concerning given what we're seeing in some of the other countries.
The XE variant has been found to be slightly more transmissible than Omicron and Omicron BA2. Dr. Curion says because of lower case counts and less testing, finding a new variant here becomes more difficult.
It's quite possible, but we haven't detected it just yet, definitively here. But there are strains that are circulating overseas that probably have made its way here and just not being picked up.
So yes, it is true. It is possible that the XE coronavirus variant is already here in South Texas. But just like with all the other previous variants, vaccinations and boosters are your best weapon to fight whatever this pandemic has to throw at us. For the Verify team, Jeremy Baker, KENS 5.
Well, we are now more than 2 years into.
So, as we could see in that video, there's still another COVID variant on the way, and due to this, it's just important now as ever that we take these preventative steps, such as vaccinations, masks, etc.
So here are some other resources for those who are still hesitant. Individual experiences can be awesome for, just like answering those questions, like personal questions. Definitely ask around to see your friends and family's experience with the vaccine. I was actually required to get the vaccine for school. I live on a college campus. So I shared my experience with my dad, who was hesitant at first, and then he was actually convinced to get it as well. And then he took that to like my grandma and everyone else in my family. So it was really nice to be able to share my experience with it and then have my family like realize, oh, I get it is a good idea. And since like Aubrey did so well with it, I'm gonna get it too. They actually did a research study on virtual reality experience. So the virtual reality experience was 3 more times effective in encouraging people to get vaccinated versus when a group of people were shown just text and images. So definitely look around and see different programs such as virtual reality if they're offered near you, because this is a screenshot from it and it's just a super cool experience to like see that and just have it played out in real life. It shows you when people get vaccinated, how close you have to stand to someone, and how quickly it spreads through like a crowd like this, where it looks like everyone is like 6 feet apart, which is really interesting. And just being able to like live it in real time. Definitely look up videos if you're a visual person like I am, and just to see how it works. And then accessible information. Misinformation, like we all said earlier, can be really toxic and just negative for the whole community. So we're going to provide some reliable resources in the next slide that will answer all your questions correctly, and then you'll have confidence in what you're actually taking when you take the vaccine. And then this is also just a video going back to like personal experiences. This is a video about a pediatrician who's also pregnant. And pregnant women was a big population who were hesitant about the vaccine first because of how it could affect the unborn child. So it's crucial just to like get those experiences from other humans, because how we relate to each other is crucial. Empathy within the human race plays a huge role. So we're just going to watch this video on if the vaccine is safe for pregnant women from the perspective of a pediatrician.
I'm Dr. Lisa Costello, a pediatrician, and I'm 37 weeks pregnant and up to date on my COVID-19 vaccination, including my booster. I'm a pediatrician who takes care of children in the hospital, so a pediatric hospitalist. I am originally from Weirton, West Virginia, a steel mill town in the northern part of West Virginia, and I've done all my training at West Virginia University, where I attended school for undergrad, medical school, and completed my residency, and now work here. A question that I have commonly received from friends and colleagues is this vaccine safe for people who are or want to become pregnant? I myself had that question, and I myself am now pregnant. I was first vaccinated before I was able to get pregnant, and then I got pregnant, and I've been boosted since being pregnant. When we're pregnant, our immune system gets a little weakened, and so we really need to have all the protection that we can to protect ourselves and our newborn. In fact, the majority of people that we see that are pregnant, that end up in the ICU, that need a great deal of help to breathe or to maintain life, are not vaccinated. We also have seen, particularly for individuals who are not vaccinated, they can have really severe disease where they are not even able to really interact with their newborn because they're so sick from COVID. That's why choosing vaccination really is the safest and most effective way to provide protection to keep not only mom safe, but also baby safe. So one of the things that we're learning more and more about is that when a person who's pregnant chooses to be vaccinated, they also pass along immunity to their unborn child. So really, when you're choosing vaccination, you're protecting yourself and your newborn child. We have also learned that the vaccines are safe for people who are breastfeeding, and one of the benefits of breastfeeding and being vaccinated is that you can also pass along immunity or antibodies to your baby through the breast milk. I got vaccinated before I was able to become pregnant, and we have seen many individuals get pregnant after getting vaccinated. So we know that these vaccines are safe and effective, and what studies have shown is that there's no impact on a person's ability to become pregnant if they choose to be vaccinated. These vaccines have undergone the most intensive safety monitoring in U.S. history, and we continue to monitor their safety and effectiveness. So we really have seen that the vaccines are safe for children and they're effective. What's been so heartwarming is children coming to get vaccinated and saying, I'm getting vaccinated for grandma or grandpa or someone who can't yet be vaccinated. So really we see children wanting to do their part as well to help protect themselves and their loved ones. I always encourage parents to ask questions to their pediatricians that they may have, whether it's about COVID-19 vaccines or other vaccines or other questions they may have, and to have that discussion with a trusted healthcare professional who knows your child best. We know that vaccines have the power to stop epidemics and pandemics. And so we in the healthcare field were very hopeful when the vaccine were available and remain hopeful because we continue to see the impact that the vaccine has at preventing severe disease, hospitalization, and death.
So now we're going to talk a little bit about some reliable resources because there are a lot of media sources out there that do talk about COVID. So these are just some of the ones that we felt were pretty reliable and consistent to go to. One of them was NPR. It's an independent nonprofit media organization based in Washington, D.C. And if you're not interested in COVID news, you can also learn about other groundbreaking news on NPR. And then the New York Times, which is where we shared the Florida vaccination rates. They update it pretty frequently. So if you're interested in that, hotspots, they also show hospitalizations and other data on the New York Times. The CDC is another great resource. They're going to give you the most up-to-date information because they are also the ones that are putting in the regulations and policies. And then, of course, we'd be doing a disservice if we didn't mention Florida Health and Duval County. So they are also a wonderful resource. And if you're more into the scientific basis and new and upcoming technology that's with COVID-19 or other medical technology, the Journal of American Medical Association, that is also another great resource. So I'm gonna go to the next slide. And we just wanna know, do you know where you can go to get COVID resources? All right. So 88% of us said yes, and then 13% said maybe, which, you're more power to you. Like, it's admitting that you might not know everything. That is a good thing, because that means you're open-minded, because you're at this conversation. But nobody said no, so that's also good. So next, we're going to go into some future steps. And so the challenge of vaccine hesitancy didn't start with COVID-19. And it won't end with it. LaQuenty, are you there?
Can you hear me?
Yes.
Can you hear me? Okay, so according to WHO, vaccine hesitancy is known as one of the top 10 threats to global health, which increases death rates in unvaccinated people. The challenge of vaccine hesitancy didn't start with COVID, and it will not end with it. So without addressing the root causes of vaccine hesitancy and building vaccine confidence, more preventable infectious disease may occur, more lives could be lost. You can go to the next slide. Congress, administration, political advocates must continue vaccination catch-up to maintain high immunization coverage rates. These efforts are especially critical for low-income populations, color, and children. You can move on to the next one. So some recommendations to increase vaccine confidence are to partner with trusted community leaders for vaccine administration and education, maintain the highest levels of vaccine safety by increasing awareness, understanding, and usability of the vaccine safety for providers, policymakers, and the public, increase access to and use of all routinely recommended vaccines by increasing the availability of vaccines in a variety of the nation by supporting global immunization efforts and developing global health importance. And we can also increase knowledge and confidence in routinely recommended vaccines by counting information and increasing public support for the individual and social benefits of vaccination. We can also foster innovation and vaccine development by supporting the development of innovative safe kits. And these recommendations were significant to the COVID pandemic, but they're also important to help build vaccine trust for the future.
So going into small business training regarding COVID-19 and mental health training. The Jacksonville Urban League is doing a free small business training called Project Reach. And if you know any small business that is interested in some just mental health resources and COVID-19 training, just reach out to our intern coordinator through this email. And we know that if anything, COVID-19 has definitely taken a toll on all of our mental health. So it's important to get training and get the resources and help that you need, because just like any muscle in our body, it needs some exercise. So just here are some community resources regarding COVID-19 vaccine booster booking, as well as testing and mental health resources. So you can find and book a COVID-19 vaccine or booster at vaccine.gov. And also, if you are worried about potentially having COVID-19 and spreading it, you can also look for testing sites on Florida Health COVID-19.gov/testing sites. That will give you some of the most up-to-date information. And we know sometimes it is hard to support our youth when, well, I am a youth, but it's hard for parents to support their youth when they're also going through something. So sometimes directing them to some other resource is the best option. So this LSF's health systems has free 24/7 mental health resources for Florida's youth and young adults, so 25 and under. So I still qualify, yay. And then, of course, the National Alliance on Mental Illness, Jacksonville Helpline, and Classes for Mental Health. So that is Jacksonville specific mental health resources. And then we just wanted to thank you guys all, and it's your turn to call the shots. Do you guys have any questions?
This is Michelle. I just wanted to say thank you all for the work that you've done and holding these town halls. Thank you.
I was just looking, as serendipity or luck would have it, I got a notification from the New York Times that long COVID is, you're less likely to get it if you have a vaccine. And even if you do get it, it's likely to be less impactful than it would be had you not been vaccinated. So even more reason to get vaccinated. Jamie, Aubrey, Cecilia, Juliet, thank you so much. LaQuentia, for your presentation. Did we have any more information to share? All right.
Well, I just want to say, going off of what you just said, Dennis, I actually know a few people who, like, I'm on a college campus, so like it has the potential to spread a lot. And like I've known people who go into quarantine in one of our apartment buildings, and my one friend actually said like he would have had to go to the hospital if he was not vaccinated. So he was vaccinated, boosted, like all of it, and he still got it, and it's still kind of like just like hit him like a truck basically, and he had a really tough experience with it. And then so he went to the doctors and quarantined and everything, and they told him that he definitely would have been in the hospital had he not even been boosted, much less vaccinated. So it is still sadly alive and out there, and that just, it's very scary to think that even if you're like vaccinated and boosted, like you could still get it, potentially be sick, you know, you'll be out of work. So it really is just an inconvenience and a health issue still to this day. So definitely the more people that get vaccinated, the better we are down the road. So I agree.
LaQuentia, I know that you work in the healthcare industry. What have you noticed of late relative to vaccines and support for vaccination in your field?
So, well, when I was working in the OBGYN office and I was working, with pregnant patients, everyone was wanting to get vaccinated because no one wanted to vaccinate onto anyone, children, elderly patients, because we were across the hall from oncology. So we had cancer patients in our building as well. So everyone was vaccinated. If they weren't vaccinated, they were wearing double masks to protect everyone.
Thank you.
You're welcome.
Any other questions or comments? I wanted to ask Richmond Wynn about, you're on a college campus and deal with students a lot, and you're a professional counselor of the utmost kind, lots of experience in various fields. have you noticed an ease of tension relative to COVID and more willingness to get vaccinated on campus?
I don't know so much about the willingness to get vaccinated because unfortunately we can't ask those questions and can't require people to be vaccinated, but we certainly have put a lot of energy into the campaign for vaccination and other CDC protocols on campus. Things have changed. Excuse me. Recently, there's less mask wearing and less social distancing. I hope there's still hand washing and sanitizing, but you never know. And so we are headed into the end of our spring semester, and so summers usually we experience, have fewer students on campus during summer, but there's still quite a few people around. And I'm hoping that we don't see a surge or an increase in infection because of this sort of lull. And this lull is not just on our campus, it's, country, it's all around the country. There have been some lax requirements. So I don't know about vaccinations, if everybody is getting vaxxed and because of that, they are more relaxed about the other protocols, or it's just that we're in this phase in our country where people are more comfortable not wearing masks as often and not social distancing. So it's hard to know. We have had similar conversations to this town hall on campus. Probably more last semester and in times last year than we have this since January. So maybe we should follow up and have a conversation with our campus community to find out, where they are and what motivates this shift in using the CDC protocols, using protective devices or whatever, and getting vaccinated. Maybe it's time for us to have that conversation.
Yes, thank you very much.
Yeah, unfortunately, I don't have more concrete information for you, but the time will tell.
Well, I was also wondering, from a mental health perspective, have things gotten better with the onset of vaccination? Has it improved the state of mind, I guess, of the students?
Yeah, I think so, because of the availability of vaccination. So we've had vaccination clinic at different stages on campus over the last couple of years, and we certainly have scaled back in due to the lack of response or the lack of interest, but we're ever ready to ramp that up if need be. So we certainly have seen, less of an interest, but I think that people on campus know that the resources are there, they're available. We at one point were distributing free at-home tests for all members of our campus community. And I know a lot of people took advantage of that. I certainly did. And so that was a good thing to see. So just to see fewer people reaching out to get tests hopefully means that fewer people were being exposed or having symptoms. It's hard to tell, but I hope that is the reason why we saw fewer people reaching out and asking for tests, and that enabled us to scale back our testing and the availability. The availability of testing.
Thank you.
Yeah.
Thank you very much. I didn't mean to put you on the spot there, but
no, that's okay. Well, another thing I was thinking about was how helpful this conversation is because I think, you know, there's, and I'm thinking too that we, again, why we need to continue having this conversation on campus is because there are people who may not have been vaccinated and obviously or boosted, and may still have a lot of those concerns that were mentioned early on in the presentation. You know, it's become less popular to be skeptical about about people's concerns, and people's concerns are valid. I was so glad to hear you all say in your presentation that these concerns are valid. You said it over and over again, so thank you, that these concerns are valid. And I think one of another thing that came to mind as I was listening is that it's so important that we have a relationship with our healthcare providers, whoever they are, wherever they are, so that we not only have access to these resources, but so that we can talk to our healthcare providers about our hesitancy when it comes to vaccinations, that we can talk about, you know, what our concerns are, and hopefully our healthcare providers can help not only provide information and support, but point us in the direction of additional resources that that can help. So it just happens to be on the heels of me going to 2 medical appointments today, and I am very talkative with my healthcare providers. I don't let them rush out the room until I get all my questions answered. And so so this is really, really relevant for me today as well. So thank you.
Thank you. Good for you. And Chairperson Godfrey Watson, Pastor Godfrey Watson, I don't mean to put you on the spot either, but I just wonder, your congregation, have you seen any changes with the prevalence of vaccine? Has it helped your congregation?
Yeah, Dennis. So it's interesting. When Mr. Wynn was speaking, that's actually what I was thinking about, because when we actually did a town hall with the church, and I had some of the executives from Ascension come on, because there were several people that had a hesitancy as it relates to the vaccine. And so I believe in leading from the front. So myself, my husband, we were vaccinated first. Our daughter, she's in the room with me right now, vaccinated, son, daughter-in-law. So we were leading from the front. But what we did is, and just like you said, people do have valid reasons. The other thing is, the other one that's on here with me, she's in the dining room listening, and that is our nurse. Her name is Rosalind Jones. And the other thing, she's here in the house. I'm going to get into all this and kind of put a cute bow on it real quick. But we also we take care of my mom and my sister. My mom is going to be 87, and my sister has several healthcare challenges. Okay. So what we did is leading from the front, but we also had to protect what's within. And so we did. So that's what we did. Now, what we noticed is that several people really had a lot of questions there. You know, oh, it's a conspiracy. It was all this stuff that people were saying about the vaccine. But again, I just believe that if I'm going to be an advocate, I'm going to lead from the front. And here's the thing. And I said to people, I didn't do this just for me, but I did it for you. And so that was another key thing. I did it for you. I did it for the other people. As a pastor, if I'm there, I'm doing it for you, to make sure that I'm being responsible for what I do and leading you properly. So I guess the short answer is that yes, we had an increased number of vaccinations. There were people who did get COVID, but we did have an increased number of vaccinations. I will say that there are more of us now that are vaccinated than those of us who are not. And with that being said, I still do drive-in services. Drive in, put your window down, and I will be right outside, and we're in the open. And so I just again, I have to be mindful of people who are not vaccinated, and that I have to be around people here. And that's a big deal. And so, you know, I can't just come home and say sorry.
Mhm. Right, right.
So,
Yeah.
and I didn't know if Roz was still there, but she's on the line as well. But she knows they're like masked up. She probably looks like she has a hazmat suit on right now, but they're in here and they're masked up. See, there she is. So
That's great. Well, I know my mother is 102, and yeah, she's out in California, and she has two nephews living with her and helping her out. So she's blessed with that, but we always worry about infection. Well, thank you, everyone, and particularly our interns who put this together. This is great. It's good to hear from those of you who are under 25. And I think having these recordings are helpful for others of your age to hear. And then it's also great to hear from some of us more senior, their experiences and to share their wisdom. So on behalf of the Urban League, I want to thank all of you and look forward to having you in our subsequent sessions. You have a great evening and a great rest of the week.